I'm showing you how to learn pharm in a short time frame. Pharm is something that's going to get you points. You have to have this mentality. Don't have the mentality, and it's sad to say, of what we do when we're in med school. You learn, you push information, you study, you memorize, and you pass your quiz and tests. This is not anything you have taken before. This is very, very different. A lot of information in a short time frame. So typical is this. Atypicals are these. Okay, cool. Look at this. We have metabolic adverse effects, endocrine adverse effects, QT prolongation. Oh, these people were playing us because this said QT shortening. Oh, so that's out. Ideally, you go little by little, one by one. You dissect it, eventually realize that honestly, when you get down to endocrine here, you have hyperprolactinemia, galacturia, oligomenorrhea, and gynecomastia. So the point I'm trying to make is, if you want to get points, this is how you do it. Boom. Now, you might say, this is easy, Stavros. No. I know it's easy when you open book. I need you to know the other ones. I need you to go through all of them and learn the best you can and say, you know what? This is tricky, man. That was QT prolongation. And granulocytosis, potentially life-threatening side effect of clozapine, which, like risperidone, is atypical. However, risperidone rarely causes granulocytosis. Oh, okay. There it is. So you see, this is good, but this is not the drug of this. This adverse effect is not risperidone. Here, this adverse effect is clozapine. Clozapine causes this and causes seizures and causes myocarditis. So I used to read this in med school and try to memorize, write cards out. It was a waste of my time. Well, not all, but I realized as I do this now more for a living and help students and physicians pass medical boards and their fellowship boards and everything, test taking is an art skill, and it's an art form, right? It's a technique. So when you go through all this, you can write them out if you want, or you can just do a couple of questions in a focused manner, like right here, and say, okay, I'm going to go through each one. This one, clozapine. Shorten, well, that's actually QT prolongation. Gynecomastia, many things can cause, but this is basically what I know. Hypothyroidism, actually, is a potential side effect of lithium. Okay, I remember that. I remember doing that. Risperidone and other antipsychotics do not affect the thyroid. And weight loss, risperidone and other atypicals are associated with metabolic side effects like hyperlipidemia, high sugar, and weight gain, not weight loss. So the test writer, what they did was they tried to play with us, and they put opposite effects, opposite adverse effects. That's all. So what I want to do now is do as many as we can with the time remaining, to show you that if you take your time little by little and learn this medication through questions, I promise you it's going to be very, very easy for you to conquer and get a lot of points. For example, check out this one. It's a little intimidating, but we talk about tables all the time, right? What do? We do this. Let me read. Let me zoom it in a little bit. Read the last 2-3 lines, right? Okay, let's start from here. She was started on a new medication. Her symptoms have improved. Lab study shows hemoglobin. Okay, labs are here, guys, so don't worry about it. You don't have to memorize labs. Labs are always here. So you go to heme, you check hemoglobin, females 12 to 16. So she's good. Leukocytes, I know, are low automatically. Leukocytes are 4,500 to 11,000. Here it is. So this is really low. So what I usually do is highlight left, right is high, left is low. Yes, yes.